Thank you very much. We are sorry for the technical difficulties we had at the beginning.
Colleagues, Ministers Mary Ng and Anita Anand. To protect our friends, families, and neighbors, we must all do our part. As we've said over and over again, this means limiting our contacts, wearing a mask, and most certainly it means staying at home and do not leave the country for non-essential travel. Le gouvernement continue à se concentrer.
The government will continue focusing on what is in the interest of all Canadians. The interpreter says that there are some technical difficulties on the line, and unfortunately, I'll have to interrupt.
D'améliorer les mesures, par exemple, à nos frontières internationales. Our government is committed to helping Canadians navigate the challenges of the pandemic, including economic support measures appropriate to help Canadians and Canadian businesses. And that's why I'm happy to turn it over to my colleague, Minister Mary Ng, who has a few words of another important measure that we have to support Canadians. Mary?
Thank you very much, Dom, and good morning, or rather good afternoon, everyone. Bonjour à tous. Since the very first day of this pandemic, our government's top priority has been clear: protecting Canadians' health and safety and supporting our businesses as they do the same. Today, our government is furthering our commitment to support Canadian businesses. We're announcing the launch of the Highly Affected Sector Credit Availability Program, or HASCAP.
Today, our government is furthering our commitment to support Canadian businesses and workers by announcing the launch of the Highly Affected Sector Credit Availability Program.
Will offer 100% government guaranteed loans to Canada's hardest hit businesses so that they can bridge the other side of this pandemic. Businesses will be able to apply for HASCAP beginning next week at their current financial institutions. HASCAP loans will have a fixed interest rate of 4% across the board with flexible repayment terms of up to 10 years. From that small mom and pop shop to larger tour companies, businesses can receive loans from $25,000 to over $1 million based on the size of their operations. Hard-hit businesses, like a chain of hotels or restaurants with multiple locations under one related entity, could be eligible for up to $6.25 million. The support is to help our businesses that have been hardest hit. So as long as a business can demonstrate a significant decrease in revenue, so at least 50% in at least 3 separate months among the previous 8 months, your business can qualify for HASCAP. So whether it is your favorite neighborhood restaurant, that bed and breakfast, the local movie theater, or even a franchise restaurant or hotel, businesses that have been hardest hit by COVID-19 will now have the support that they need to keep moving forward. We know that supporting hard-hit businesses isn't just the right thing to do for our economy, it's the right thing to do for the employees, families, and the communities that these businesses support. Nous reconnaissons qu'investir dans les entreprises les plus touchées n'est pas seulement une bonne mesure pour notre économie, c'est une bonne mesure pour les employés, les familles et les communautés que ces entreprises soutiennent. From launching a website to making curbside pickup easier, to creating a robust marketing strategy for boosting e-commerce, or even investing in the tools needed to support and to launch into new markets, we know that HASCAP will give our businesses the support that they need, not just to survive this crisis, but to recalibrate, to plan, and to make sure that they are on that road to recovery and to future prosperity. We've been listening to and supporting businesses since the start of this pandemic from coast to coast to coast. We've worked with businesses to keep employees on payroll, help with fixed costs like rent, and provided the additional support through lockdown support. Like all of these programs, HASCAP will be another important lifeline for our hardest hit small businesses. This pandemic, but until I want businesses and community leaders who are watching today, those who have been tireless at advocating, from our local BIAs to chambers, to business associations, to heads of restaurant associations, tourism and hospitality industries, I want you to know that we have your back. Thank you. Merci. And with that, I will turn it back to you, Dominic.
So, merci beaucoup, Mary. We're obviously happy to take the questions now. So over to you, Corinne.
Thank you. Merci. We will have a 15-minute period of questions now. So we will get to the phone. Nous allons procéder à une période de questions d'environ 15 minutes. Donc, nous allons procéder au téléphone, une question et une question de suivi chaque. One question, one follow-up each. Opérateur.
Thank you. Merci. The first question is from, la première question est de Grant Robinson from the Globe and Mail. Please go ahead. À vous la parole.
Oh, hello. The question on the vaccine rollout first. Anita, how much of the vaccine plan for Canada is predicated on all of the proposed vaccines proving out? For example, if one or several of them do not, how much does it throw off the forecasted plan for vaccine rollout?
Well, thank you so much for the question. I want to begin by saying that our strategy from the very beginning in procuring the largest number of doses per capita of any country in the world with 7 vaccine suppliers was to ensure that we had multiple options in place, because at the time we contracted, we weren't sure which vaccine would be successful, which horse would cross the finish line. And so we diversified our portfolio so that we had many options on the table once a vaccine was discovered. And so what we have continued to do is provide numbers to Canadians of where we would stand in terms of our inoculation schedule with approved vaccines, as well as where we would stand if additional vaccines come online. So at the current time, with approved vaccines alone, we are able to say that we will undertake 36 million vaccinations by the end of Q3. That's just with Moderna and Pfizer procurements alone. And then we have another track, a second part of that schedule. As additional vaccines come online, we would be able to reach 73 million vaccinations, taking into account those additional procurements. But of course, at this time, we should be focused on the approved vaccines because we have enough to inoculate all Canadians prior to the end of September. Thank you.
Thank you.
Did you have a follow-up?
I do have a quick one if I can get it in. Yeah. If other ones come online, if things go well with the other candidates, is there, and I realize it's probably too early to be specific on this, but is there a possibility, or is there a model where you can move up that fall deadline by several months? Let's say if 2 or 3 of them prove out in the next phase.
Just before you answer, sorry, I would just like to remind everyone to go on mute, please. Thanks.
It's a very good question, and I want to begin by saying that I am fighting for Canadians every single day in terms of our vaccine procurements. We are undertaking unrelenting efforts to contact all of our vaccine suppliers and beyond to ensure that we can get vaccines into this country as soon as possible. So in terms of your direct question, it is possible that that timeline could be moved up depending on the approvals of additional vaccine candidates. And that indeed, as I mentioned, is what I'm working on every single day as we are in this government to protect the health and safety of Canadians.
Okay, thank you.
Merci, thank you. Next question, prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Hélène Buzetti de Le Devoir. Please go ahead. À vous la parole.
Good afternoon. I don't know who I should be putting my question to, but the Prime Minister told us that prohibiting air travel may have an impact on our supply chain because planes also contain goods. Could someone please give us an idea of the amplitude of the problem? I did not know that passenger planes transported lots of goods as well. Answer, thank you for the question. From what we understand, there are many cases where passenger planes traveling from various destinations or coming in also accept to transport goods on board their passenger planes. They could be medical equipment or other important equipment for our supply chains. Any decision to prohibit or cancel commercial flights must take into account the economic impact or any impact it could have on our essential supply chains. We are still discussing the matter, and as the Prime Minister said, we are looking into any additional measures that will be taken in the next few days. Follow-up question, Mr. Leblanc, should we take it that airlines have made representations with your government to warn them against this risk, and has there been any warnings? Answer, I won't describe any such thing as a warning, but there have been talk about any potential changes regarding international flights coming into Canada. Of course, this is of concern to airlines, and I know that they quickly called my colleague, Minister Gabra of Transport, and we also have discussions on the way with airlines to talk about any possible financial support we can provide. Whenever we talk about the possibility of prohibiting flights or prohibiting flights to some destinations, they quickly take up their phones to call.
Question?
Thank you. Merci. The next question is from La prochaine question est de David Thurton from CBC News. Please go ahead. À vous la parole.
Yeah, it's a two-parter here. Thank you so much for taking the question. And if Dr. Tam can answer the first part, if Janssen says they will be reporting their long-expected data on their vaccine soon, and I know Dr. Tam is not the regulator, but has the regulator told her anything about when the timeline for the approval of this vaccine? And Minister Anand, if and when the vaccine is approved, how soon could we see doses start leaving the factories and heading towards Canada?
So perhaps I can just start, and then Anita can answer the second part of the question. Dr. Tam and Dr. New had to leave the news conference because of the technical delays. They're actually not with us, but we'll make sure that specific question, if it's not Dr. Tam, then somebody from Health Canada, the regulator, can answer that specific question for you. So we'll be happy to follow up on the first part of the question. Anita, perhaps you want to look at the second part of the question.
Thank you so much, Don. I'm in touch with suppliers with my team every day to ensure that once vaccines are approved, that they can be delivered to Canada as soon as possible thereafter. And so our conversations regarding J&J and AstraZeneca have already begun with those corporations. And indeed, we are asking if they are interested in pre-positioning their doses, as well ensuring that as soon as possible after regulatory approval, we have those vaccines in this country for delivery to Canadians. That is one of the priorities of my ministry and our government, and we are working very hard on that every day. Thank you.
Okay, and just a quick follow-up. It's about the Moderna vaccine. Minister Onen, do you regret choosing not to exercise your option for up to 60 million doses of the Moderna vaccine? This is given some of the issues, of course, well publicized that we're having with Pfizer, and also because of the potential impact of EU export controls.
So that decision regarding the 16 million doses is not my decision. We in PSPC are acting on the advice of the Public Health Agency of Canada and the Vaccine Task Force. Now, the important point to remember is that the basis of that decision was that those 16 million doses were not going to arrive before the end of Q3. And our goal is to ensure that all Canadians have access to a vaccine before the end of Q3. So that was the reason we exercised 20 million Moderna options and 20 million Pfizer options, because those suppliers did tell us that they would be able to deliver those options doses to us before the end of Q3. Once we have assurance from suppliers that they can provide early delivery, then the rationale, the options. So it's really important to note, and I've mentioned this point many times, that those 16 million doses would not have arrived before the end of September 2021. That was the basis for the decision. And I think it is very important for people to understand that with our current procurement approach, we have been able to procure enough doses for all Canadians to have access to a vaccine prior to the end of September 21. And that's with the exercise of the additional 20 million Moderna and the additional 20 million Pfizer vaccines. Indeed, prior to the end of the year, we should have 70 million, at end of September, we should have 70 million vaccines in this country. Thank you.
Merci, thank you. We will take a final question. Nous allons prendre une dernière question. Opérateur.
One last question.
Merci. The last question is from, la dernière question est de Juliane Lapointe de Radio-Canada. Please go ahead. À vous la parole.
Juliane Lapointe, Radio-Canada. Good afternoon. The European Union would like to control vaccines coming from Europe. Do you think this could have an impact here? Do we even have any guarantees that we'll receive our deliveries? Is it possible for us to negotiate with other countries like the US to obtain our doses from elsewhere? I'm not sure who can answer that question. Go ahead, Anita. Thank you very much. Let me start by giving the floor to Mary Inc., Minister Inc. Of course, we are in constant contact with our colleagues to resolve the problems that arise. We are convinced that our suppliers would fulfill their contractual obligations as new vaccine supply chains are introduced. We can, however, expect some short-term temporary disturbances. But whenever a country takes measures to limit supplies that are vital to other countries, they are slowing down the global response to the pandemic. We know that this virus doesn't raise borders. And we are also in contact with the governments of the world in general, because we are all working to make sure that vaccines are rolled out as quickly as possible. Our government is fully committed to ensuring the integrity of our supply chains, and deliveries are continuing in Canada. I have communicated directly with Minister Gano on this topic. The interpreter, unfortunately, will have to interrupt service because there are sound issues. Interpretation will resume once the sound allows.
Merci, Anita. I want to share that our government and I have been in contact with my counterpart EU on this very important issue. We do not expect that the EU will restrict exports, and our government is fully engaged to ensure that we are securing and continuing the delivery of vaccines to Canada. We will continue to work with the EU, just as we have done throughout this pandemic, to make sure that our critical health and medical supply chains remain open and they remain resilient. And we share the urgency with Canadians to make sure that life-saving vaccines come here as quickly as possible. We've heard that from Minister Anand. And our government is operating with this absolute sense of urgency every single day. And we have been in contact with my counterpart in the EU. Merci.
Et peut-être en relance, une question pour le ministre Leblanc. Qu'est-ce que vous dites aux provinces qui s'impatientent? Parce que là, ce qu'on fait, c'est qu'on annonce des annonces sur d'éventuelles mesures pour les voyages. Donc, on reste quand même dans le très peu concret là, en ce moment.
Mais évidemment, moi, je pense qu'on peut constater que nous avons pris des mesures très concrètes et très sévères aux frontières internationales depuis le mois de mars. Alors, l'idée qu'on n'a pas une posture robuste et efficace aux frontières n'est pas vraie. Cependant, nous avons entendu.
I have spoken myself with some premiers who are asking that we consider stiffer additional measures at the borders, be it at the airports or at land border crossings. Mr. Biden's government has asked to have discussions with Canada and Mexico when it comes to a coordinated position we can adopt at the land borders. So the situation is constantly evolving. But as we said, and as the Prime Minister repeated this morning, additional measures will be taken to add to the already robust measures in place. These measures will be announced in the coming days. We are perfectly aware of the concerns of Canadians, as expressed by the premiers of the provinces and also from our colleagues in the caucus. We are hearing this from Canadians all over. We shall be announcing measures that could be quickly implemented in the coming days.
Merci à tous de vous être joints à nous.
Thank you. This concludes today's press conference.
This puts an end to today's press conference. Have a great